Hi there, I'm Hamish. I'm one of the doctors working on the ward today. I've been asked to come and do an examination of your cardiovascular system. What that'll involve is me having a look at your hands, your face, your neck and your chest, having a feel around these areas and also having a really good listen to that heart as well. Do you have any questions about that?
No.
No. Can I just confirm your name and date of birth?
It's Michael Ratcliffe, 15th of May 1995.
That's perfect, Michael. Okay, now I'm pretty happy with your position, but what I would do is ask, can you remove your shirt just so I can have an examination? Is that alright?
Yep.
Okay, now I'm going to be talking whilst I'm going, Michael. So just starting with general inspection, the patient looks comfortable at rest. They're not requiring any aids or adjuncts. There's no oxygen. There's no cardiac monitoring on. I can't see any cardiac devices around, like a GTN spray. There's no obvious scars or deformities of the chest wall. Okay, and the patient is alert and speaking to me. Next, Michael, can I just have a look at your hands? Can you bring those up for me? So I'm just having a quick look at the hands, and I'm looking at the colour of the hands, and that's nice and equal. I'm looking for any evidence of any splinter hemorrhages. Can you flip those hands over for me? Now, looking for any evidence of any Janeway lesions or any Osler's nose, which I can't see, and there's no evidence of any arachnodactyly, which is good. Michael, can I get you to bring your fingers together like that for me and make a wee diamond with those fingernails? That's fine there. Okay, and if you put your hands back out for me, I'm just going to compare the temperature of these two. Okay, and I'm just going to have a squeeze on this finger, Michael. Okay, 1, 2, 3, 4, 5. 1, 2. That's good. The hands are warm and well perfused, and capillary refill time is less than 2 seconds. I'm just going to have a feel at their wrist now, Michael. Okay.
Mm-hmm.
Okay, and that's a rate of about 64. I'm just going to compare the two. Okay, that pulse is nice and regular with a good character, it's well filled. And there's no evidence of any radial delay there. Now, do you have any pain in the shoulder, Michael?
No.
Now what I'm going to do next is we're going to have a feel of your pulse, and I'm going to briskly lift your arm, okay? Looking to feel for a collapsing pulse, but if you have no pain, you let me take this weight, okay?
It's fine, yeah.
And relax that there, okay? That's fine there. And there's no evidence of any collapsing pulse as well. If I was struggling to feel that pulse, I would offer to palpate a more proximal pulse, but that's not required because I can feel a distal pulse. I would also offer to measure blood pressure at this time. Would you like me to do so? That's fine. Okay, now I'm going to have a look at your face, Michael. So can I get you to pull down one of your eyelids for me? That's great. So I'm looking for any evidence of any conjunctival pallor, which I can't see. No corneal arcus or xanthelasma, that's fine there. No evidence of any malar flush at all. Can you open up your mouth nice and wide for me? Now I'm looking to check his dental hygiene in case there's any need for any future cardiac surgeries. No evidence of any high arched palate or anything like that. That's fine. Now, what I'm going to do is I'm going to have a wee quick listen to your neck, Michael. Okay?
Yep.
So I'm just having a quick listen for any carotid bruise. There's no evidence of any bruit there, so I'm just going to quickly palpate the carotid pulse. And I'm doing that one at a time as well. Okay. That's fine there. Now, Michael, can I get you to just lie back a little bit more for me, looking for a degree of about 45? And if you turn your head to the left for me, now I'm just having a quick look to look for the jugular venous pulse with a JVP, which I can't see there. Now, do you have any pain in your tummy at all, Michael?
No.
No, do you mind if I have a press on your tummy?
Of course.
So I'm just going to check for hepatojugular reflux. And I can now see the JVP, but that is settled and it's less than 3 centimetres of elevation. That's fine there. Okay. Next, I'm moving on to a look at the chest. Now, there's obviously no implanted devices like a pacemaker or defibrillator. There's no evidence of any cardiac scars, particularly in the axilla or the midline. And I can't see any obvious pulsations at the moment. No obvious chest wall deformities either. Next, I'm just going to have a feel for it. Okay, so I'm just going to feel for what we call the apex beat.
Mm-hmm.
I can feel that there. And that's in the mid-clavicular line. And that's the fifth intercostal space. Okay. I'm now going to feel for parasternal heave. Which I can't feel there at all. And for any thrills. I can't feel any thrills there either. I'm now going to have a quick listen to your chest, Michael. Okay.
Yep.
And as I'm doing that, I'm just going to have a feel of this pulse again. Okay.
Mm-hmm.
I'm just going to do that one more time, Michael, all right? Now what I'm going to get you to do, Michael, is can you roll onto your left side for me? And can you take a deep breath in and out and hold it there? That's fine now. You can breathe normally for me, Michael. Next, can I get you to sit forward for me and take a big deep breath in, out, and hold it. That's fine there. You can breathe normally for me there, Michael. I can't hear any murmurs. There's no need for me to look for radiation at this time, okay? I'd also offer to have a listen to the back. Can you have a quick sit forward for me, Michael, and I will have a quick listen there.
Yep.
Deep breaths in and out for me. That's fine there, and I'm just going to have a quick check for any evidence of sacral edema. And I can't see that there, that's fine. If you lie back for me, Michael, okay? I'm just going to have a wee quick look at your legs now, okay? So just on general inspection, there's no obvious swelling and no obvious edema. I can't see any evidence of any chronic venous disease or skin change. Any pain in your calves at all?
No.
I'm going to have a squeeze on these, okay? Not tender.
It's fine, yeah.
So there's no pain in the calves, they're soft and non-tender. I'm going to have a wee press on these shins, okay? And there's no evidence of any pitting edema there, and I can't see any evidence of any previous vein grafts. That's very helpful, Michael, thank you. That concludes the
very much.
examination. Okay.